Myself, Dr. Anjana Unnikrishnan, I will be your host for today. Dr. Rahul, am I audible?
Yes, ma'am, you are audible.
Good evening, ladies and gentlemen. So this is our course. This is actually our first course of 2022 and our third batch of Keraleeya Panchakarma. 29 days online certificate course. This is our first program we conducted on cosmetology. This is next. Yeah, so this is our first course on cosmetology with eminent faculties. It was well appreciated and well received, and we are again going to conduct our third batch on cosmetology. Next. This is our first batch of Keraleeya Panchakarma. We only had 8 faculties and now we have 12 faculties on our next batch. This is our first batch of Agnikarma. Next. This was again a well appreciated course of ours, clinical utility of Uttarabasti. It was a 4 days course. Next, we again conducted a class on 14 days online class on aromatherapy. Next. This was one of our special course conducted on clinical methods and prescriptions in Ayurveda. It was well appreciated and well received. It was a 34 days online course. Next. We again conducted a 10-day session on Vasti Karma. Next. So this was our again a very important course of ours, a 31 days course on Subhalyam. It was one of a kind. Next. So we again conducted classes on Ritu Samiksha, 15-day online class on exploration of gynecological disorders. And we again conducted class on skin disorder. It was named Sparsha. It was a 24 days online certificate course. Next. We conducted classes on Rakta Mokshana. We conducted almost 2 batches of Rakta Mokshana. Next. Keraleeya Panchakarma. This was our second batch of Keraleeya Panchakarma. Again, next. We again conducted classes on cosmetology, our second batch. Brahat Saptaha was a very special course of ours. It was a 21 days course conducted by 17 gurus of Ayurveda. Next. Again, our second batch of Agnikarma. We conducted a course on art of infertility management in Ayurveda. It was named Prajananiya. Next. Again, Uttarabasti second batch. Aromatherapy second batch. Niramaya was one of a kind, another course on rheumatology. It was a 12 days online session. Next. It was our course on diabetics. It was a 14 days online course on, it was named Neha. Next. We conducted a course on varicose vein named Sirajam. Our latest course was Prakrishtam, a clinical assessment of Prakriti. It was also a well-received and appreciated course. Next. So this, let me welcome you to our present course, Keraleeya Panchakarma introductory session. Let me thank you all for being on time. And so let me welcome you, first guest of today's evening. So today we will be conducting an introductory session. That is, all our eminent speakers will be present here. All of them will be taking or giving you introduction of what they are going to take in this 29 days online session, so that you can make an informed decision before joining the class. So first speaker is Dr. Anand sir. Before welcoming him, let me give you a brief introduction about him. He has been with us from the first course of ours, and he was very supportive and always with us, helping us throughout the journey. So Dr. Anand A, MD, BAMS from Sri Jayendra Saraswati Ayurveda College, Chennai, 2008. He in MD Panchakarma from SDM College of Ayurveda, Udupi, 2013. He has a yoga instructor course from S. Vyasa, Bangalore, and joined as associate professor in Vishnu Ayurveda College, Shornur, in the year 2014. He's presently working as associate professor and HOD in Department of Panchakarma, Vishnu Ayurveda College, Shornur. He's the managing director of Niranjanam Ayurveda, Ottapalam, chief consultant and Karuna Foundation, a charitable trust, Palakkad. With immense pleasure, let me welcome you, sir.
Thank you, Anjana. Thank you for the brief introduction.
Thanks.
And good evening, one and all gathered here. It gives immense pleasure to be part of Pratijna Group once again and to work with Dr. Shyam, Dr. Anjana, and Dr. Rahul. Thank you once again. And the third session of Panchakarma online course is again on. And this time, I will be dealing with two topics. The first one is the special treatment procedure that in Ayurveda, that is Dhara Kalpa. The word Dhara is familiar with everyone as it is often the icon of Ayurveda treatments. The cover page of majority of the Ayurveda treatments will be Dhara. And here the discussions on Dhara will be covering certain points like the principles of Dhara, its classification and its utility, the procedure of Dhara, its preparation of Dhara materials, the Aushadha preparation, as well as the standard operative procedure of different types of Dhara, especially Taila Dhara, Takra Dhara, and Kshira Dhara. The widespread usage of different Dharas in Keraleeya Vaidya Granthas also will be enumerated here, like Yoga, Mrida, Chikitsa, Manchari, where we find different types of treatment procedures, like not only insomnia. Other than that, we see treatments on Prameha, Ikka, Shwasa, etc. So we have a different type of treatment modality in these granthas, and that also will be dealt with. The other areas covered will be the recent advancement in this Dhara Kalpa, as well as the research works carried out in this area. Okay, so these are the areas where Dhara will be dealt. And the second topic of mine will be on principles and practice of neurodegenerative diseases, and with special reference to Parkinson's disease, where we Ayurveda people have an upper hand in managing the diseases very effectively. Its symptomatology and the Ayurvedic approach to this treatment will be dealt with. Okay, and the discussions will be planned in such a way that students and as well as upcoming practitioners will be benefited by this course. So let me conclude my brief introduction on the topics dealt with me. Thank you one and all for the patient hearing. Dhanyavad.
Thank you, sir. Thank you for that introduction. And thank you for being with us throughout the journey. So our next, before going on to our next speaker, let me give you an information. Dr. Rahul will be posting a WhatsApp chat group address on the chat box. Okay, there will be a link shared of a WhatsApp group into the chat box. So those who want to join this session of 29 days, please go in, and click onto the link and join the WhatsApp group so that you will get every detail regarding this Panchakarma session. Let me introduce you to our next speaker, Dr. Praveen V.S. I feel immense proud and I feel blessed to even have him in our team. So let me introduce you to him before handing over the mic to him. Dr. Praveen V.S. got his BAMS degree from Ayurveda Mahavidyalaya, Hubli, Karnataka. He did his MD from SDM College of Ayurveda, Hassan. He's currently working as professor and HOD Department of Panchakarma, Alva's Medical College and Hospital, Moodbadri. He worked as physician in Ayurveda Chikisalayam. He has also worked as assistant professor in Department of Panchakarma in SDM College of Ayurveda, Hassan. He has done certificate course Advanced Yoga from Arsha Yoga Vidyapeetham. He has done almost 30 publications of various national and international journals. He has received Agnivesha Award, Pattabhisheka Award, Best Paper Award. These are some to name a few. So without any further ado, please let me welcome Dr. Praveen sir. So please take over the session.
Good evening, everyone. Am I audible?
Yes, sir, you're audible.
Yes. So it gives me immense pleasure to get associated with the team Pratignya. As everyone knows that we are passing through a very difficult time for last 2 years. We have seen several curfews, weekend curfews and lockdowns and whatnot. The total system is seems to be like got collapsed for literally for 2 years. Now that we hope that with the this new year 2022, May this all sourness will go, and we will come up with new things, new hopes, and new adventures and good things. So in this 2 years, why I have mentioned this one is that the problem with these 2 years passing through such a difficult status, that was not only for a common man, but also in the field of education. And I have personally been in the education system for such a long time. I have seen that we all have faced difficulties, including looking at the students. They have suffered a lot. Now that the health universities have come up with a new idea and going ahead with the colleges and other things, it is now it is being streamlined. But for last 2 years, it was very difficult. Why I'm just bringing this to your notice is because we have learned new things, because we were not used to such a platform. Take for that matter 2019, before 2019, such kind of platforms were not there. And if anybody would have wanted to know more things about a particular subject, they need to enroll themselves for national seminars, international seminars, and other seminars, and physically they used to go there and listen to various speakers. And now this platform has a wonderful opportunities. It has created such a wonderful platform for learners. As long as you have the zeal to learn, as long as you have the hunger to learn, you can learn so many things from this e-platform or through the internet. And this kind of courses have done wonderfully well. And I congratulate Team Pratijna for taking up this platform and doing such a noble service to the education system, as well as even the students. I don't say that even when we are speaking about such courses like the courses on Panchakarma or any disease and management and other things, these students need not get dejected by saying that this is only for practitioner. Anyhow, they are going to become practitioner in future, and they are going to get so many new things. Now, the another beauty thing about the such kind of course is that once they listen to a practitioner, listen to a orator, then they get some sort of knowledge. And in the later stage, what they can do is that they get the recordings for another 6 months or 1 year, so that they can just go through it again and again, so that a very minutest information what is being conveyed by the practitioner, by the orator, that would definitely help them in learning again and again. That is a very good thing. That's why in this regard, I would like to congratulate the team Pratijna for taking up such a wonderful, doing such a wonderful work in this field of Ayurveda and education and practice as well. So as far as the Panchakarma is concerned, everyone knows that Panchakarma is one of the very good branch, lucrative branch. I would say I'm saying that most of the people do get attracted with this Panchakarma branch just because you can make money. So with this intention, most of the people land in Panchakarma, setting up a Panchakarma theater, and they will go ahead with the Panchakarma practice. But the problem lies when you don't have proper knowledge of Panchakarma and you start doing the Panchakarma, and most of the times it is being seen right now. What is being seen is that most of the people who practice, I don't blame, please don't make mistake of my words. But I have seen many of the people who have started practicing Panchakarma, they are not practicing judiciously, ethically. That is what is the cause of concern for a person who is already in practice of Panchakarma for long time duration. I feel pain that most of the people in the name of Panchakarma, they practice only external therapies, and they say that I have done all Panchakarma, but the result is not seen. But that is not true. Panchakarma, when you compare with that of the other branches of the Ayurveda, other branches can be correlated to that of a very particular branch in the contemporary science. But Panchakarma is a unique branch which has got no parallel, no comparison. So most of the times, that is the reason why most of the people used to consider it as they used to neglect, the contemporary science used to neglect this branch by saying that what nonsense is this science is talking about. Because when a person gets purgation for 1 day, 2 day, or even in the case of Nityarechana, and making the person to vomit, what changes the treatment can bring about in a patient's body. This is what is the perception by the contemporary science for many years. And I make it very clear that since last 10 years of the research, the researchers have pointed out at importance of gut and its role in maintaining the health as well as curing the disease. Take for that matter, even a very recent article which has been published in the BMJ gut, which stated that gut has got a vital role in preventing the complications of COVID-19. So there are so many instances where I can give a number of the references regarding the articles, various researches which are conducted on the gut. That shows that the Panchakarma is going to be one of the very important branch even in the contemporary science in years to come. I'm sure that within 10 to 15 years of time, this Panchakarma is going to play a vital role in maintaining the health as well as curing the disease. So in this regard, Panchakarma plays a very important role. But more, as I said before, the Panchakarma, in the name of Panchakarma, anything is being practiced. Or people say that I am practicing Panchakarma. But the question is that practicing Panchakarma and practicing Panchakarma ethically has got a difference. Practicing Panchakarma and practicing to the perfect is having the difference. That's the reason why Ayurveda points out at the complications. Complications, when you see, search the total textbooks of Ayurveda, most of the times the name Vyapat, name complication is not being mentioned in majority of the place. But this concept of complication is been very much explained, elaboratively that is been explained in the context of Panchakarma. The reason you need to understand is that the Panchakarma, when it is done judiciously, when done correctly, and that is done ethically, then only it has got fruitful outcome. Otherwise, there is a chance that the complications are quite natural. So at the time of complications, you cannot blame the system. Most of the times when I speak about Vyapat has got two extremes. One is Ayoga and Atiyoga. Most of the times Atiyoga complications are seen. Ayoga complications are not being observed. It is not that it is not seen or it is not at all confronted. Most of the times it is not being observed. So in this regard, what I would say that this course of Panchakarma not only aims at the theoretical explanations. I make it very clear, because theoretical knowledge you will get in undergraduation, you will get in post graduation, and I'm sure that most of the people know everything about the theoretical aspects. But what we would like to, even clubly, I'm just telling that everyone in this platform, I know them personally, so everyone would give a very clear practical version of each and every procedure which is being explained, and making it sure that whoever is listening, whoever is getting an idea, he will get it perfectly. So that's the reason why I would say that we would be discussing more from the practical point of view. In this regard, I would be taking this total session, I would be taking around 6 different sessions I would be engaging, and among these 6, 3 would be based on the Snehapana, and among them one is Shodhananga Snehapana, second one is Shamananga and Brahmananga Snehapana along with Aupedaka Sneha, and third one would be based on the practice of each and every variety of yoga, specifically concentrating on each and every yoga which is being utilized in the practice to the best of benefits. So in this regard, as far as the Snehapana is concerned, most of the people have got so much of queries, so much of confusions, because different versions are there. Charaka's version is different, Vagbhata's version is different, and even the later Acharya, they have created some complication. I mean, they have confused the reader whenever they have explained about this Snehapana, and what sort of dosage increase which is being recommended, because this increase in the dosage, the Arohana variety of Snehapana, that is not being explained in Charak Samhita or Sushruta Samhita and Vagbhata, but it is being explained in the later Acharya. Which one is to be selected? Can you select in particular patient when to select Sadhya Snehapana, when to select Vicharana Snehapana, when to select Arohana Snehapana. In Arohana Snehapana, how do you increase the dosage from day 1 to day 2, day 2 to day 3, and so on? How are you going to practically increase the dosage? And when do you feel that the Samyak Snigdha Lakshana is being achieved? Most of the times, even misinterpretations are there as far as the practice of this Snehapana is concerned. So in this regard, most of the times, without making it more confused, what I would like to do is that I would be very crystal clear in my explanations regarding the practical version of this both varieties of Snehapana, the Shodhananga Snehapana, Shamananga Snehapana, as well as Brahmananga Snehapana. So these are the 3 sessions I would be taking in the beginning, and the later stage I would be taking 2 more sessions related to that of Virechana Karma. So in that Virechana Karma, there are different varieties of the concepts are there, and there are confusions are there. Suppose a patient is being administered with 50 grams of Trivrit Leha on that particular day, and patient has purged only 2 times, and the patient has not achieved Samyak Virechana Lakshana, what to be done? Such questions are generally being asked. Can you leave the patient as it is? Can you repeat the total procedure? In the name of repetition, is it really required to go ahead with the Snehapana and starting from the Snehapana and ending with the Virechana again? Or can you give administer this drug? And on that particular day, if the person has not purged, then how do you assess that the drug which you have administered, has it gone digested? Or can you repeat it on that particular day? What sort of complication patient has got? So there are so many complications, so many confusing situation arise for a practitioner. So can you do it on OPD grounds? So this is another, most of the times people do ask about this OPD grounds. Can you perform Virechana? Because there is a practice of performing the Virechana Karma. Most of the people do practice in OPD grounds. Can it be done? Or IPD admission, is it mandatory? So these are certain questions which generally I'm sure that most of the people would have had this varieties of questions. There's so many questions are there. So these all practical aspects, including the drugs which are used and the dosage which are commonly practiced, and how to vary the dosage, how to change the drug, how to select a Snigdha Rechana, and how to select or where to select Snigdha Rechana, where to select Ruksha Rechana, and these all aspects would be dealt in these 2 sessions of Virechana in the later stage. On the last session, I would be speaking on the various treatment protocols as well as treatment which are planned as well as executed in the management of Pakshagata. I'm sure that since long, most of the people had bread and butter with this by treating this Pakshagata. And most of the times, what most of the people might have done is that only external therapies, managing as it is, like very simple external therapies, and managing it to certain extent. So that is what is the general aim, to make sure that the rigidity reduces and strength to certain extent it improves, and all these things are general agenda. But I would be speaking in this session, I would be speaking about the stage of that particular Pakshagata, and in acute stage, what sort of treatment has to be done. In chronic stage, what sort of treatment has to be done, especially from the point of view of the proper Panchakarma, including Virechana Karma and Vasti Karma and Nasya Karma, where to select and how to select, how long to do these treatments, and repetitions if it is required, how exactly you are going ahead with the protocol of treatment. Time and again, how do you implement various varieties of treatment in managing Pakshagata. Pakshagata, in a broader sense, this word Pakshagata is being explained, and there are so many pathologies come under this broader version of Pakshagata, and I would be touching on this point of managing Pakshagata or hemiplegia or faciobronchopleural hemiplegia and other varieties of neurological disorders in general, for that matter. So these are the 6 different varieties of session I would be engaging. 3 would be based on related to that of Snehapana, 2 would be on Virechana Karma, and last one would be on the treatment protocol as well as treatments in the management of Pakshagata. With this, Cyrus, thank you.
Thank you, sir. Thank you for such a wonderful introduction. So I would like to inform the participants that after you have heard all these sessions, you can take an informed decision whether to join this course or not. Or so if you want to join the course, there's a link given in the chat box where you can click and join the WhatsApp group. All the details regarding this session and the video itself will be posted there. So please join the group if you want to join in this 29 days of Panchakarma learning. Why to join this course is because you are getting knowledge from 12 of the famous Vaidyas all around Kerala and Karnataka, who will be sharing all their knowledges in the respective fields. So let me introduce you to our next Vaidya. A very famous academician and a very humble human being. We are blessed to have him in our team. Vaidya M. Prasad sir is a native of Central District of Thrissur, Kerala. After his BAMS from Vaidyaratnam Ayurveda College, Ollur, Thrissur, and post-graduation Shalakitandra from Government Ayurveda College, Trivandrum, he started working as a specialist in Sitaram Ayurveda Specialty Hospital, Thrissur for 4 years, and later in 2006, along with his wife Vaidya Shriniya Verma, established their own Ayurveda ashram and research center named Sunetri in their home district Thrissur. He has 25 years of clinical and 17 years of teaching experience. Vaidya Prasad sir served as a principal and superintendent of Ashtangam Ayurveda Chikitsalayam and Vidyapeetham for 5 years. Parallel to the regular classes in Ayurveda College during early 90s, he learned the principles and practice of Ayurveda under the legendary Acharya Padma Bhushanam Vaidya Bhushanam K. Raghavan Tiruvulpad sir, which he continued for 21 years and got trained in clinical Ayurveda under Padma Shri Dr. K. Rajagopalan. He loves to explore the possibilities of informal Ayurvedic learning and teaching and is engaged regularly in conducting learning programs called Samikshas. This year, he is appointed as Guru for the CRAV program by Rashtriya Ayurveda Vidyapeetham, New Delhi. So with immense pleasure, let me welcome you, sir. Please take over the session.
Okay. Namaskaram and good evening to all of you. Thank you, Dr. Anjana, for the introduction. And first of all, let me congratulate Team Pratignya for once again coming up with this wonderful session on Panchakarma. And as I did in the previous sessions, this time also I'll be giving you an introduction to the application of Panchakarma in the background of understanding Roga. So I was listening to the previous speaker who was so categorically mentioning that, okay, it is all about getting real hands-on training. Yes, it is true, because most of the techniques that we have to employ in the practice of Panchakarma is something which is to be gained by practice. That is true. There is no doubt. Abhyasal prapyade drishti karma siddhi prakashini ratnadi sadasat jnanam na shastradeva jayade. That is true. But at the same time, he was very categorically mentioning that the misuse or the overuse of Panchakarma is also going on, maybe in an unprecedented manner, because it has become a buzzword in the industry these days. So that is where sessions like the one which is conducted by Pratignya is becoming very, very relevant and important, especially for the practicing physicians. I'm saying or stressing on that point because, see, Panchakarma is taught in the BAMS classes, in the PG classes. True, it is true. But at the same time, there is a difference. there is a huge difference between what is practiced or what you see in the academies and what is to be done in your real life practice. It is, I'm not talking about any sort of a contradiction between the academy and the practitioner's realm, but what you see in the academy is actually something which is modified so as to show the students, the pupils, what all things can be done in the most elaborate manner. That is not what you're going to do in your private practice, especially if you're a private practitioner. You will have to do the precise, the best selected kriyakrama in the shortest time of, in the shortest period of time, making sure that the patient, somebody who is on the receiving end, is getting the best out of it. So his or her investment in terms of money as well as time in the entire event of disease cure should be minimal, and the outcome should be the maximum. In the college or hospital, say for example, if you go to in general, a government Ayurveda college hospital in any state, in the most of the states, you will find an admission period of sometimes 2 months. Sometimes in a chronic ailment, the patient may be getting admitted for 2 months, sometimes more than that. And this patient will be undergoing almost all items of the menu. That you cannot do in your real practice. So what is taught and what is being practiced, there is a difference, and that difference is not a theoretical difference, but it is a practical difference. So understanding these sort of very sharp ideas about the practice of Panchakarma is very, very important. And in that understanding, in that sort of a practice, the exact understanding of the theoretical part, especially the dosha part, is very, very important. I would like to tell you a story about it. I will not prolong my session. I will take maybe another 5 to 8 minutes, doesn't matter. See, one day morning, one fellow, the father of a 5-year-old girl, maybe on a standard working day morning, was just browsing through his daily newspaper, and immediately the daughter came to him and started pushing him to come for play with her. But the father was actually having no time, because he has to rush through the paper, the next routine, and then go to the hospital. So what the father did was, he saw one map of India on another newspaper which was there on the tabletop. He took that newspaper sheet and tore it into pieces, maybe 100 pieces, and put those 100 pieces in front of the daughter and asked her, you realign the India map, then call me, I'll come for the play. You know how difficult it will be for a 5-year-old girl to align the India map in 5 minutes time or 3 minutes time or whatever it is. And surprisingly, you know, the girl made that map aligned in 3 minutes time and started pushing the father again. Come, 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 I have made the map clear. Come for the play. And the father was literally surprised, because he never expected that at least for another 15 minutes, the girl will not come. And surprisingly, with that, element of surprise, he asked, what did you do? How did you manage this? Then the girl told, I do not know where Kerala is, where Tamil Nadu is, where Jammu Kashmir is. But when you were tearing that paper, I saw the face of another fellow on the other side of the paper. I know very well where the nose is, where the forehead is, where the ears are. I made that clear. So I made the man clear and the map became automatically correct. In the same way, when you have a thorough understanding about what Vada is, what Pitta is, what Kabha is, and what Ama is, what Nirama is, what Alpadosha is, what Prabhuda dosha is. So when you move around the basic principles of dosha, Agni, Ama, and the Roga Margas, forget about the other paraphernalia, the other details of the entire stuff. The things will fall in line. So for doing proper Panchakarma, hands-on training is quite essential, no doubt at all. Do it, do it, do it, and do it. No other way. But at the same time, whenever you are doing something, whenever you're practicing something, do it right, practice it right, so that every treatment done will make you a better Vaidya. And when you do the same treatment next time, make sure that you are not the same Vaidya who performed the same treatment before. For that aspect, I think we should have a balance, a tapas, a continuous effort for understanding the human body in terms of Ayurveda. So in this session, I will have an introductory part on the first day. I will not be taking much of the time in that introduction, but I will try to say the basics of Panchakarma. Of course, it is a very generalized one, a basics about what Roga is, and also something about how to connect these two aspects while you are putting them into the consultation room in your real practice. So looking forward to see you all in the sessions. Thank you. Best wishes to all of you. Thank you, Dr. Anjana and Team Pratignya. Shubharatri.
Thank you, sir. Thank you for such a wonderful introduction, sir. So thank you. Those who want to join our sessions, please join the chat box or go to the chat box and click on the link there. Even on a WhatsApp group will be given. There you will get all the information regarding this session, all the syllabus, the payment options, everything. So go and go to the chat box and please click onto the link. How this session is different from other sessions are, or as the teacher stated, there are many online classes going on and there are many in your academy also. How this is different is you get different point of view from all of these Vaidyas. It's a focused discussion on Panchakarma. For 29 days, you will be completely focusing on that. You can clear all your doubt over the WhatsApp group. There will be a WhatsApp group where all of these teachers will be there. There, they will be giving answers to all of your doubts. So you won't, if any patient is there and if you want to clear your doubt, this will be like a hand-holding session for you. They will be there whenever they get their time to solve your decisions and solve your questions. And this group will be active for almost 6 months. So that is why this session is important. It will clear your doubts. It will make you more focused and you will get different point of views from all the eminent Vaidyas. So with that, let me introduce you to our next speaker. Again, a very humble human being, always been there whenever we needed her. Very helpful madam, very famous academician, Dr. Pratibha CK. Dr. Pratibha CK, before I welcome her, let me introduce her. Dr. Pratibha CK, Professor, Department of Panchakarma, GS Ayurveda College, Philkua, UP. She did her BAMS from KVG Ayurveda Medical College, MD from STM College of Ayurveda, PhD ongoing at Utkal University, and academic experience of 13 years of undergraduate teaching and 8 years of postgraduate teaching. Authored a book titled Shodhaniya Siddhi, published by Chowkhamba Orientalia, Varanasi in February 2015. Awardee of Vagbeda Puraskaram, awarded at National Conference on Panchakarma, Vagbeda Ceremony, Todupuda, and appreciated by Amrita Vishwavidyapeetham during the year 2014-15. published about 22 articles, and conducted many guest lectures and TV programs. So let me please welcome ma'am to the session. Please take over the session, ma'am.
Namaste. Om Shri Gurubhyo Namaha. Om Shri Dhanvantare Namaha. First of all, let me thank Pratignya platform for providing me again a chance to share my views on Panchakarma. They are working since last 2 years to promote authentic Ayurveda or Shastriya Ayurveda. In that matter, they have covered, I think, almost all the Ashtangas of Ayurveda. I think all the 8 Angas have been covered. Now again, Panchakarma is coming. So, Jnana Sadhana, when Acharya says about the Shreshthas, for Jnana Sadhana, Shastra Sahita Tarka Jnana Sadhanana, the best among the Jnana Sadhana is Shastra Sahita Tarka. That means in knowledge of a subject or critical knowledge of a subject based on Shastra background. So there should be a Shastra background to practice, to promote a subject in Ayurveda. So that is what Acharya wanted to explain there. And in that matter, most of all of our speakers here today will be speaking based on that only. Because Ayurveda is Anadi, Ananta, its principle doesn't change. Even though it is Panchakarma, there is no North Panchakarma, South Panchakarma, Keraleeya Panchakarma. So Panchakarma is same. No Western Panchakarma, no Eastern Panchakarma. Panchakarma is same. There is no change in the principles. Only to the attitude in which you see into it with respect to the patient differs from person to person. And that difference is based on the Shastra knowledge you have. That is why in Ayurveda, it is only in Ayurveda who says the Buddhi Medha Karo Ganaha. So to improve Buddhi Medha, if you see in other system of medicine, they will give you some tablets or some medicine. But in Ayurveda, it's not like that. They say, Satatadhyenam Vadaha Paratantravalokanam Tadvaidyacharya Sevacha Buddhi Medha Karo Ganaha. So to improve your knowledge, Satatadhyana is needed. Along with that, Paratantravalokanam is also necessary. So Satatadhyana is possible only with once you are out of the college, it is only with the participating in some of the seminars or some of the webinars. Nowadays it is webinars, CMEs, etc. So this is a platform for improving in your Buddhi, Medha, etc. And if you are not knowing the Shastra and simply practicing Panchakarma, like for example, if you are giving a PCOD patient Virechana, without knowing also you can give Virechana. With the proper Shastra knowledge also you can give Virechana. So there is a lot of difference when you practice, because the way you select the drug, for Snehapana, from Snehapana, then how you maintain the dose, to what level you go for Snehapana, and what drug you choose for Virechana, that is different from a PCOD patient to a Kushta patient. So there's a lot of difference. So that makes a difference in your results also. So Acharya Sushruta rightly says, Yatha Kharaschandana Bharavahi Bharasya Veta Natu Chandanasya. So if you have Shastra Jnana and practice, or if you don't have Shastra Jnana and practice, it is you are compared to a donkey who carries the load of Chandana without knowing that Chandana is there in his back. So it is, if you don't have a knowledge of Ayurveda or Shastra and practice Panchakarma or any Shastra, you are like a donkey who carries Chandana on his back, but doesn't know that it is Chandana is there in his back. Okay, so don't be like that. So go to Shastra in depth and that is possible with this platform. And you have many, there is a lot of Vaidya Samoham, Nissamshaya Karana. So all your samshayas will be driven off with the seminars you attend in here. And like in our text also, there are Basti Visharada, Bastignya or Vamanajna are also there. So here also you have many experts in different fields. So in this regard, I will be dealing on Vamana and Basti and the complications. So totally all the three subjects are purely a practicals. So I will tell you about how to conduct Vamana, where to conduct Vamana, where not to conduct Vamana, the procedure, how you have to select the drug, what are the complications, how Samyaks Lakshana has to be understood, what are the researches done in the field of Vamana, and my experience in different, with different yogas in different conditions. That will be dealt in one session. And another 2 sessions on Basti, even the same for Basti also. Basti is a very large, vast topic, but still I have almost 20-25 different yogas of Basti being practiced, and I will be sharing about all those things. And the most important Vyapats, what you have to do when a Vyapat is in front of you, how to manage it, how to approach it. So that will also be dealt. And as you know, by learning through these classes, I would like to quote a shloka from Vagbhata, where he says that Bishajam sadhu vrittanam bhadram agamashalina abhyasta karmanam bhadram bhadrabilashina. You will be bhadra, you will be always respected, you will always, the fame will come to you when you are a bhishak with sadhu vritta, with well behaved, you have a good conduct. When you practice with having the knowledge of theory and also practical knowledge, so you will always be respected, and the fame will be there with you. And finally, let me conclude by saying the very common shloka, which I like it very so much, and you will also like it. Kvachit dharmaha, kvachit maitri, kvachidarthaha, kvachideshaha, karmatmanaha kvachit cheti, chikitsa nasti nishpala. Panchakarma is a chikitsa. It will never be unfruitful. Nishphala. That is, it will never be unfruitful. In some areas, it will be your dharma to perform it. In some area, it will give you some friendships, friends. In some area, you will gain money. In some area, it will give you fame. And always practice this, the eternal or the so-called holy Ayurveda and Panchakarma. It will never be unfruitful. Try to join the classes, get the knowledge, practice authentic Panchakarma. Thank you, one and all.
Thank you, ma'am. Thank you for being there and giving such an introduction. Thank you once again. So if anybody want to join our session of 29 days on Panchakarma, please go to the chat box. There will be a link provided by Dr. Rahul. You can join the link, and this today's video including everything you need to know about this course will be shared there. So let me welcome our next guest, Dr. Rekha KV. She has been with us from first batch itself, a very famous academician again, and a go-to person for any doubt related to Sukhachikitsa. So let me introduce her first. Dr. Rekha KV completed BAMS from Government Ayurveda College, Kannur. Secured post-graduation from MS Shalakitandra from Government Ayurveda College, Tripura. Has 5 years of teaching experience in Shalakitandra at MBR Ayurveda Medical College, Parshnikadavu. Later joined Indian System of Medicine Department of Kerala Government as Specialist Medical Officer. Netra conducted Drishti project of ISM department for school-going children at GAH in Nalikuda. Currently working as Specialist Medical Officer at GAH Dwaraka, Wayanad. Please take over the session, ma'am. Rekha, ma'am.
Hello.
Hello, ma'am. Welcome, ma'am.
Thank you, Dr. Anjana.
Thank you, ma'am.
Very good evening to one and all. So first of all, I would like to take this opportunity to congratulate the team Pratignya. So because they are again starting the same course on Panchakarma. Because we know all the courses conducted previously were really impressive, and I'm sure this will be a very beneficial course as the students are concerned. So in this course, as I did in the previous classes, I have 2 topics, and my first topic is Netra Kriya Kalpas in general practice. So you know all the means we have most of many IDCs are coming in our OPD. So when we are practicing, general complaints, in that there are many complaints related to netra and ENT, ear, nose, and throat, etc. and etc. So we have many treatments like ocular kriya karmas, that means netra kriya karmas. So as there is difference between treating the general cases and ocular complaints, because if any mismanagement from the part of the physicians may lead to complication. As eye is concerned, that may vary from simple blurring of vision to complete blindness. So we should be very careful by dealing with the eye diseases. So for managing these eye diseases, we have many treatments. As compared to systemic management, topical administration of medicine is very important as eye diseases are concerned, because we have many barriers in our eyes. There is blood retinal barrier, blood brain barrier, etc. So when we are administered the drug systemically, it's very difficult to reach the target tissues. But if you are administering the drugs directly into the eyes, that's topical treatments, so it's very easy to reach the medicines into the target tissues. So topical management is very important in netrarogas concern. So we have many treatments like Seka, Ashwatana, Anchana, Tarpana, Pudabaga, etc. So you must be very thorough, you should be very familiar with the Kriya Karmas. Then only you can manage the diseases very properly. So in my session, I would like to discuss with you each and every procedure in detailed aspect along with the practical demonstrations. And if we are getting any complication, we should manage the complications also. So I'm discussing a few cases and which are the treatments, ocular treatments included in that cases, and how the procedure is conducted, and which are the complications, arrived, and how to manage the complications, etc. So I think this portion will be very beneficial to you people while dealing with the OPD cases and also IPD cases. And my second topic is practical aspects of Nasya Karma. So before that class, you have detailed classes on the procedure and all other aspects of Nasya Karma. So I'm planning to discuss with you few cases because we know Nasya is very important in managing Urdhva Vikareshu. And then Acharya Vakpada says, Urdhva Vikareshu Visheshan Nasya Mishyade Nasahi Shirasodaram Tena Tadmyape Handita. Because nose is the gateway of Urdhvanga. So any diseases are affecting the Urdhvanga. In Urdhvanga, there is chance of there are involvement of tridoshas in Urdhvanga. We have Pranavayu, Tarpaga Kapha, Alochika Pitta, etc. and etc. in Urdhvanga. So there is chance of every time there is chance of Kapha Ulkreshna in Urdhvanga, and this Senda is the root cause of all other diseases. So we have to eliminate this Kapha. In every disease, initially we have to remove this Ulkrishta Kapha. So Nasya is very much important in removing this Ulkrishta Kapha. So in the we have a different cases. I mean, in case of as headache is concerned, we have a sinusitis, migraine, and a trigeminal neuralgia, neuralgic variety, vascular pain, etc. So in all these headaches, there is we have a less Shamanaushadis as in Shala Ketendra. So we have the big procedure. It's one among the important Panchakarma, the Nasya Karma. So in my class, I would like to discuss each and every cases related to Netra Roga and the Karna Roga, Nasa Roga, and especially Shirogas, because Shirogas are very, very common in our general practice. We have wonderful treatment in Shirogas. So I would like to discuss all the cases related to each and every session, all these diseases and their complications and the management of the complications and all. So I'm sure all the courses were very effective. So all of you join the course and you all should become a part of the team Pratignya. Thank you, everyone. Thank you.
Thank you, ma'am. Thank you for such a wonderful introduction. So those who want to join the course after hearing these many lectures so far, these many introductions of and these many teachers, famous personalities who are famous in their field, and they will be there to clear all your doubts. So if you want to join this course, please go to the chat box and click the link given for the chat WhatsApp group, and there you will get every detail regarding this course. So with that, I will move on to our next speaker. Our next speaker is Dr. Simi Ravindran, again a very famous physician and a very humble human being. She's always there for us, and despite of her busy schedule, she has joined us today. So Dr. Simi Ravindran, Assistant Professor, Department of Panchakarma, Government Ayurveda, Kerala. She has completed her Bachelor of Ayurvedic Medicine and Surgery from Government as a first rank holder under the University of Kerala in 2004. She ranked Vaidya KGK Panikar Memorial Award for the Best Outgoing Ayurveda Graduate of Kerala. She completed her MD in Panchakarma from Government Ayurveda College, Trivandrum in 2009 and joined as medical of ISA in Indian System of Medicine in the same year. After her 9 years of service, she joined as Assistant Professor in Government Ayurveda College, Kannur, and later joined in Government Ayurveda College, Trivandrum, and further to the current institution. She presented paper in international and national seminars. She's a teacher, clinician, and several activities for popularizing Ayurveda. With that, welcome you, ma'am.
Okay, welcome. Thank you, Anjana. Welcome, Vaidya, respected Vaidya Samuha. Welcome to all our eminent teachers and also co-doctors and Pratignya team and their students. All welcome to all. So it's a lot of time now about the introduction. I just go through my subjects. So coming to my subjects, I'm dealing with the Ruksha Svedas. You all know about the OP Panchakarma treatments, etc. Okay. So it is I am discussing about the varieties of Rukshna procedures, Ruksha Svedas, etc. You all know about the Keraleeya Panchakarma, especially the Sweda Karmas. The modification of the Sweda Karmas are mainly practiced in Kerala Vaidyas, traditional Vaidyas, etc. For this marma management and also for the Sudhika Paricharia, extra like that. So we will discuss detailed about the traditional Keraleeya Panchakarma, Ruksha Svedas, etc., including varieties of Patra Porla Sweda. So varieties of medicinal leaves we are using. Some for Vrishchika Visha, etc., we are simply using this Arka Patra, and also we are using many type of combined Patra Porla Sweda, etc. We will discuss thoroughly through the sessions, and also Shashti Pinda Sweda, that is rice porridge Swedas, etc. That type of Swedas, Pinda Swedas, varieties of Pinda Swedas we are discussing during our session. And also we will discuss about the special Kalari Kiris, etc., including Anda Swedas, etc., and their varieties. We will discuss thoroughly about the permutation and combinations of various type of Kiris, how we will select a Kiri, how will you design a Kiri, how you can measure or design a Kiri for our OP management, their home treatment, etc. You can easily make these Kiris after these classes and also. So and also Valuga Sweda, etc. After that, we are going, next discussion is about the Kerala special pediatric treatment about the Shiropiju, Talapodichil, Talam, etc. These are very Kerala specialty treatment and very cost-effective treatment. So you can practice well versed in this pediatric higher mental disorders like autism, etc., like conditions, ADHD conditions, etc. You can practice it. How in all session we will discuss how to prepare these medicines, how to apply this procedure? What will be the effect? What all the things you should monitor during and after the treatment? How will you assess the efficacy of treatment? These all are we will discuss during all these sessions. Next, my session is about you all know about our simple OP management, effective treatments like Urovasti, Kadivasti, Grivavasti, etc., and special type of Upanahas, etc. You all know how to perform Upanaha, etc. But we will discuss about the special Agni Leba, extra for lower backache, special Upanaha for Kasa, special Upanaha for Apabahuka, etc. So Upanaha, that these all measures are we can perform in your OP system itself. As a day-to-day treatment extra, you can practice as simple as an OP procedure itself. So we will discuss all these in a specific manner about how to do this procedure, how to select medicine, and also if you are if you are very difficult to getting this medicine, you are thinking like that, we will discuss about the easily available company medicines like the Scottical company or the Vaidyaratnam, etc. medicines extra. That medicines are also we will discuss during this session. So welcome all to my session. So I think you will all practiced this OP Panchakarma and Keraleeya Visheshachikitsa after our sessions. Congrats Pratignya for these all sessions. Stay blessed, stay happy. Thank you.
Thank you, ma'am. Thank you for such a wonderful introduction. Once again, let me remind you, there is a WhatsApp chat in your chat group. You can see a WhatsApp link. Please join the link if you want to join the session. And every details regarding the course will be given there. The price of the course, etc. Also the syllabus, all will be provided in that group. Or if anybody has come late, don't worry. We will be posting the video of the same in this WhatsApp chat group. So with that, let me introduce you to our next speaker, Dr. Ashwati S. BAMS MD FMC, Specialist Medical Officer at Government District Ayurveda Hospital, Varkala, completed her BAMS from Rajiv Gandhi University of Health Science, Bangalore, and MD in Agada Tantra from Government Ayurveda College, Trivandrum. She also took fellowship in Medical Cosmetology, ILA MED, under Greifswald University, Germany. She has presented papers in national and international seminars and also been a resource person at several events. So with that, let me welcome Dr. Ashwati. Dr. Ashwati, are you there? And Dr. Rahul?
Yes, ma'am. Dr. Ashwati is there. Ashwati, ma'am, please unmute yourself, ma'am. Ashwati, ma'am, please unmute yourself.
Yes, we are trying to unmute you, ma'am. You are not. Please try again.
I think some difficulty with Dr. Ashwati. I think we can go to the next speaker, Dr. Renu.
I think there are some network issues from Dr. Ashwati. Let me move on to the next speaker, Dr. Renu VT, Associate Professor, Department of Shalaki Tantra at Vishnu Ayurveda College, Shornoor, and Consultant Physician at Ayushi Ayurveda Eye Clinic and Panchakarma Center, Puchinipadam, Thrissur. She completed her UG from Sri Jayendra Saraswati Ayurveda College and PG from Sri Kala Bhairaveshwara Swami Ayurvedic Medical College. She has more than 13 years of clinical experience. So with that, let me welcome you, ma'am. Please unmute yourself, Dr. Renu. Please take over the session. No, ma'am, you're not audible. No, ma'am, you're not audible, ma'am.
Hello, Renu ma'am. Ma'am, your voice is not audible. Can you please remove the headphones and hello?
Some network issues are there. So anyway, let me, can Dr. Ashwini try again? Okay, so by the time they join, let me again remind you, you can join the WhatsApp group and
Ashwati ma'am, hello. Excuse me, ma'am. Hello, Dr. Ashwati, please unmute ma'am. Hello.
Dr. Ashwini, can you hear us? Yes, ma'am, we are trying to unmute, but
Hello.
sorry, we cannot, we are not able to connect to Dr. Ashwati and Dr. Renu ma'am, can you try again to unmute? Hello, ma'am, can you please try again? Hello? No, ma'am, yet. We cannot hear you yet. Maybe and network issues are there. I don't know, ma'am. We're not able to hear you. Sorry for the delay.
Ma'am, call up Dr. Hello, Dr. Renu, is it audible? Hello. I think some network issues. We can move to Dr. Bharath's Narendra.
Okay. Okay. Let me welcome to our next eminent speaker. Sir has been in almost all of our programs. He has been very helpful and been there throughout our journey. Let me welcome sir. Before that, I would like to give you a slight introduction. Dr. S. Bharat Narendra, BA, MS, MD, PhD, Associate Professor and Department Head, Rogaldana Department in Sri Jayendra Saraswati Ayurveda College and Hospital. Research interest in the field of infertility. He has done his PhD in infertility. He has devised a new Arohana Madravasti technique and has standardized 3 symptoms in male factor infertility. He takes care of the regular Sukhachikitsa OPD department of Sri Jayendra Saraswati Ayurveda College and Hospital. He owns 2 clinics at the heart of Chennai city, Bharat Clinic and Vibha Ayurvedic Center at T. Nagar and Madipagam, with specialized treatments in Panchakarma for healing various ailments. His clinic has performed more than 4,000 Uttarabastis. He has been practicing at various hospitals and clinics under Dr. Asif Ali's Panchakarma Hospital, Attani, Dr. Murugamani MBBS MD, and Dr. R. Vimala, LHM, AMIH. Dr. Bharat enjoys devising novel strategies in Panchakarma treatment such as Basti and Kili. This is to name a few. So let me directly move on to this, sir. So please take a session.
Hari Om, Shri Gurubhyo Namaha, Om Dhanvantare Namaha. Thank you, Dr. Anjana. So, Pratignya. Pratignya is a platform where you can learn and you will be having hands-on training on with video and all that. Many people will be thinking about how do I learn.
Excuse me, sir.
Yes.
Can you audio video? Yes. Now you are not visible. Yes. Okay. Now it's.
Yeah. Okay. So Pratignya is a platform where through online you will be learning Panchakarma. This seems a little bit absurd to many people. Some people think, how can I learn through online? If you can talk with any of the old students, you will definitely come to know that we'll give a lot of hands-on training. We also support you through WhatsApp groups and so on. We also have some video descriptions which will let you know what we do here. I'm here in the capacity of a specialist. So I've been practicing infertility since the time I finished my BAMS. I'm a third generation doctor, and we have always been specializing in infertility since 3 generations. So both male and female infertility. Here I'm here to talk about gynecology and Panchakarma and gynecology. So infertility, as we all know, is becoming a pandemic. Almost 10 million cases are reported in India alone every year. And even modern day evidence-based medicine, or allopathy as we call it, if you have 100 walk-ins, they are able to help only 3 to 6% of them. But in Ayurveda, you'll be surprised to know that at least a 50% of them we are able to give a very good result, which is 7-8 times more than what evidence-based medicine, modern medicine can do. So in my chain of clinics, as Dr. Anjana said, we have done more than 4,000 Uttravastis. I just have one small clarification. Right now, I'm not the HOD of Rog Nidan department. I've resigned from that. I have started one more clinic. I now have 3 clinics in the heart of Chennai city. And here at Pratignya, I'll be talking about how Vavana, Virechana, Basti, Nasya, and Uttravasti especially will be helping you to practice specialized Panchakarma for infertility. Basically, if you take in your area, for example, let me take Chennai. If I take Chennai, I'll have maybe around 1,000 doctors in and around Chennai who are practicing Ayurveda. But if you have a specialty practice, this is what I'm talking about. When you have specialty practice, if you are an ortho specialist, if you're a gynec specialist, if you're an infertility specialist, and you project yourself like that. For example, if you are in Chennai and you Google infertility Ayurveda doctor, my name will come first because we have been practicing infertility since so many days, so many years. So it is also the way how you project yourself. I'm not talking about marketing here. The more you treat, the more you will be renowned. The more you are renowned, the more people will be able to reach you. As we all know, we have to keep practicing Panchakarma to get better at it. So I'll be sharing with you my experiences, especially with cases where I have treated some really impossible cases with the help of Lord Dhanvantari, and how women helped in fact in obese PCOS, how Virechana is helping in other infertility conditions, specific infertility conditions, endometriosis, adenomyosis, uterine fibroids. When there is a fallopian tube block, instead of going for a operation where through laparoscopy they will clear it, it's called as the tube drilling in layman's term, all that. And when there is a fallopian tube fimbriae blocking, when there is when there is PCOD, when the AMH value is low, there are umpteen number of things that you can treat. When the estradiol is low, when the testosterone, free testosterone is high in a lady patient. How do you approach all these things? What I'll be trying to let you know is practically how did I approach these people? I have my own way of approaching each patient, which I have gathered from my gurus, my mother and my father also. And I'll be letting you know how to use the punch. We have to always go back to the basics, right? Whenever you are in problem, whenever you want to learn something, always first go to the basics. I'll be touching the basics very briefly in my class, and I'll be letting you know how to use the Panchaveda Vata to select your drug, how to select your drug, which drug to select at what time, and in specific conditions, what Panchakarma you'll be able to do, and especially with Uttravasti, what you'll be able to do. This is what I'm here to teach you. So if you are a specialty practitioner, as I told you, if there are 1,000 doctors in a city, if you take it as a specialty, if you want to become an infertility specialist, and over a period of 4 or 5 years, if you keep practicing infertility, when you're being searched for, when somebody searches for a specific specialty, your name will pop up first. You don't have to do anything. You don't have to go to the Google, pay money and all that. I'm saying whenever people come in search of you, you will be one among the top 4 or 5. Imagine being the top 4 or 5 out of 1,000 doctors in your area. This is what we have achieved with Bharat Clinic and Viva Ayurvedic Center. This is what I'm here to teach you, to at least make you take the first step of becoming a specialist in Ayurveda and becoming a specialty practitioner in gynecology, especially with the help of Panchakarma. Thank you.
Thank you, sir. Thank you for such an wonderful introduction, sir.
Dr. Ashwati is here, ma'am.
Okay. Dr. Ashwati, ma'am, can you try again to unmute, ma'am?
Yes, thank you, Doctor. Is it audible now?
Yes, sir, you're on. Please take over the session.
Thank you, Team Pratignya, for this opportunity. And I think you are all, the previous courses are very well and very completely organized, nice with the eminent faculties, and it was a very successful course, I think. And also I wish this course also will be very effective course for the participants. And I think here all the faculties, they have told regarding all the Panchakarmas and how all things, I think they had covered all things. And here my topic is about the Panchakarma Chikitsas in the aspects of dermatology. So we know that directly I'm going for the topic. And dermatological cases, we can classify the cases into mild, that's mild origin, moderate and severe cases. If the skin patients are coming to us having chronicity less than 6 months and more than 6 months and is a chronic case. So most of the cases, in the case of this moderate and the severe conditions, we are adopting most of the cases this Panchakarma Chikitsas, that is Shodhana Chikitsa, and according to the health of the patient also. If the patient is more Balavan and the Dosha Dushti is Prabhuda, then only we are going for the Shodhana Chikitsa. Here we know that in OPDs, some patients they may not be able to come and admit our hospital for a long duration. So we are giving them OP levels of Shodhana therapies. So in this class, I am hereby explaining you how to select and the Panchakarmas or the Shodhana Chikitsas to a patient, and how to select the medicines for that. We know all conditions, if Shodhana, that Gridas, in the cases of dermatology, the Gridas are getting different. So when we have to collect for the Nishotamadi, when we have to go for the Araguda Mahadikta, when we have to go for this Mahadikta, when we have to go for Indagantam. So we are teaching you how to select the medicine, at what conditions when you have to start for the Snehana. So all the Kushtas, we know that that is Kleda predominant. So the Snehana at first for externally and also for the internally, we can't start at first. So we have to go for Deepana, Pachana, Shodhana, then only go for the Snehapana and all the Panchakarma Chikitsas. And here for that's Purva Karma, we are doing for this Abhinga and Svedana. So we are adopting here when to select. We know it's a simple error in our treatment that the skin conditions get aggravates. So most of the cases because of the selection of medicines. And it is in a saying that whenever we are treating a skin case, at first all the symptoms increases for a week. Then only it's going to subside. Like that one saying is there in all the, when we are approaching for a skin treatment, but actually it is, it's a fault statement. When we are giving one medicine for a dermatological cases, if the condition is getting worsening, that indicates the Anupashaya. So this indicates when to select the medicines, how to select the medicines for this dermatological condition, how to select the Sneha, when we have to go for the Vamana, where Satya Vamana is needed or classical Vamana is needed, how the Samsajana Karma have to given, with the Virejana, what medicine you have to select for the Virejana, and how to go for Karma. Like that, everything we will explain in this class. In the same way, we are going for the Nasya, when and the case where we have to give for Nasya. Some scalp psoriasis conditions, we can give Nasya. For Palitya, Khalitya, like cosmetology conditions, acne, and how the medicines we should select for that. And when we are going for the Basti, in the case of psoriatic arthritis conditions also, we have to go for the Kushta. Haravasti. So which medicine how to select that? Then the next one, like the moksha. We are adopting that Jalauka, Siravidha, sometimes cupping. So when you have to go for Jalauka Charana, when you have to go for Prachana, when you have to go for Putana, when you have to go for the Siravidha. So everything we will explain this class very thoroughly for your understanding and for your successful practice for your career enhancement. So we'll discuss very thoroughly for that. Thank you once again, and all the best for the team Pratignya for this new course.
Thank you, ma'am. Thank you for enlightening us about your courses you'll be taking. So with the time is already 8:20, I think. So people, let me welcome you to our next speaker.
Moving to Renu, Dr. Renu, ma'am.
Dr. Renu, ma'am. Ma'am, can you please try it again, ma'am?
Renu, ma'am, kindly unmute. Hello.
Hello, Renu, ma'am. Can you hear us?
Hello, Renu, ma'am. Hello.
I think there is network problem. Yes, ma'am. Can you? No, ma'am. Again, I think it's a network problem, ma'am.
Now is it audible?
Yes, ma'am. Now audible.
Okay. So warm good evening to one and all. So first of all, let me thank Team Pratignya, especially Dr. Shyam Mohan and Dr. Rahul for this opportunity. So the topic given to me here is for the presentation is the procedure of Nasya. So here I'll be demonstrating the practical aspect of the Nasya. So especially how you have to perform the Nasya correctly and accurately so that you will get a very good result from the patients. Okay. So also I'll be highlighting the different types of yogas as well as single drugs, which are mentioned in classics as well as traditional practices and textbooks will be highlighted here. And we have to understand that there is an equal importance of the administration of the correct yoga or the correct drug along with its correct matra, and the procedure should be done in a correct duration and in an accurate method. Then only you are going to get the proper result. So all of us know that the Nasya is a very simple procedure. You don't require much equipments for performing the Nasya, but it is very important you are taking the Urdhva Jatru Bhaga for performing this procedure, and it is a very important and a very cautiously done procedure, and there are some contraindications which we should always keep in mind. Okay, so these things we will be discussing, and also few experiences regarding case discussions and some researchers I will be highlighting in the topic. So once again, thank you, Team Pratignya. Thank you, Doctor.
Thank you, ma'am. Thank you very much thank you for this introduction. So with that, we will be winding our today's session. Some of the details regarding the session I would like to discuss. Can you please share the screen? Yes. So this is our today's session. Next one. We will be providing the videos of this session for a period of 6 months. This is our course fees for 29 days, that is 4,999, and the participants who have already been there for Pratignya, even one of the courses you have attended, you will get the discount of 25%, that is 3,749. And the videos of this session will be provided. Next. So these are the course details. Every detail of or the brochure will be provided in the WhatsApp chat group. So please share these details and your WhatsApp chat group link to your friends, your colleagues, those who want to join Panchakarma. Kindly forward. Next. So, so join us on 31st of January. And be determined. Please give us a chance to serve you. Next. So if you have any queries, please visit us at www.pratignya.com and reach us at pratignya@gmail.com. We also have pages in Insta and Facebook. You can go there. You can go through all the courses and the reviews given. So for any concerns and suggestions, write pratignya@gmail.com. Please save these numbers if you have any technical questions or any questions more related to this course. And there are, so this is our thought for today. Knowledge is the true organ of sight, not the eyes. With that, I will like to end today's session. There are some of the questions in the chat box, I think. If you have any questions left regarding the course, kindly give it in the chat box so that we can read it out. So some of them I have suggested for Hindi classes. Unfortunately, this is from Kerala. All the teachers are from Kerala. And if there is a thing that more than 100 people have the same questions of conducting the class in Hindi, we will think in future of conducting classes in Hindi with the translator or something like that. Next. When somebody said, when will be the recorded sessions? Where will be the record? We will every details regarding this will be given to you once you join the course. So we will be giving you how to get access to these videos in detailed manner, and you will be having these recorded videos with you for 6 months. Once you join the course, we will let you know. Any other questions? Kindly ask any questions regarding the course. I think there are no more questions. So let us wind up the session for today. Thank you very much. Thank you for being so patient, and thank you for being with us. With that, and today's session is our team. Keep learning, keep growing. Team Pratignya signing off. Good night, everyone.